So welcome everyone. It is 1 o'clock sharp, and we very much want to welcome you today. I want to say how extra grateful we are to have the speakers that we have today and to speak about bridging the gap between public health and occupational health and safety. I know since we started this webinar series back in July of last year, we have been really looking to David Fissman and Ray Copes, and so glad to cross paths with Nick Taria at Carwa. We really have a very national flavor. You'll see to today's speakers and their involvement in public health and in occupational health and safety and the science table, and really bringing us, as we have been trying to do, to you the science, up to the minute. So we're very grateful to have this, and look forward to a panel discussion afterward with all of your questions. So we're keeping all the speakers till the end just to talk a little bit about some logistics, and we, rather than asking questions following each speaker, we're again holding it to a panel at the end. So feel free to use the chat window as you wish, and we will address the questions as we can. We are going to remove video quite often because we have some bandwidth issues especially with Ray, and we'll be showing Ray's slides for him, so bear with us on that one. So without further ado, I'm going to introduce our moderator, who, along with Andréane Chenier, who we're not sure if she made it on the line yet today. There's been a lot of technical glitches, who is an LAC member and on our board of directors. Alec Farquhar has been working, tirelessly, along with, I do want to thank our COVID response team at OCAL, who have been working both internally and externally, again, to bring this science to ourselves at OCAL and to all of you in Ontario. So Alec has been helping us along with this. He has so much passion as a lawyer with a long career in compensation and occupational health and safety, especially around infectious disease and employment of persons with disabilities. So he's currently the coordinator. I work with him on Asbestos Free Canada, and he chairs the engagement for Center for Research and Work Disability Policy. He's supposed to be retired, but it just, he never stops. So he sits on the board of directors for Workplace Health Without Borders as well, where we cross paths. He has so much past influence and current influence as a director of the Worker Advisor and managing director of the Occupational Health Clinics for Ontario Workers. He also was the director of the Ministry of Labour Occupational Health and Safety branch during SARS, and operational lead for implementation of the Campbell Commission, so recommendations and partnerships with the Ministry of Health and health sector partners. So he's been involved deeply in this pandemic, in previous pandemic and preparedness planning, and played an important role establishing the MOL's healthcare unit and the Section 21 committees involving labor. He's a graduate of Princeton University and has a law degree from the University of Toronto Faculty of Law. So welcome, Alec.
So thank you, everybody. It's great to have such a good turnout on a late summer day, a nice hot day. And I feel so privileged to be part of this session, because although some of the current data is getting pretty alarming again in terms of a fourth wave, we're starting to be able to see the end of this terrible year-and-a-half experience, both in Ontario, Canada, and around the world. And of course, when you go through something like this, you've got to respond to what's happening day by day, week by week. That's the necessity of the situation. But you do start thinking, how could we have been better prepared? How could we have responded better? Whether it's literally, municipally, locally, within workplaces, or on a provincial, national, and of course, global level. And one of the crucial issues that has arisen is, let's call it the relationship between public health and occupational health and safety. This topic today is bridging the gap, but there are lots of different ways to look at the relationship. I myself lived that relationship for 3 intense years following SARS, when I was responsible for operational implementation of the Campbell report, which was really about this issue, the gap between public health and occupational health and safety. And I helped put some of the foundational pieces in place, along and very proudly working with the late Sheila Baswer, who was then Provincial Medical Officer of Health, and Archie Campbell himself. Both of them were dying of cancer through the work they were doing, and left us prematurely, huge loss. So today what we have are three pretty incredible speakers who I think come from just the right places to address this gap, and how we can do better in future and bridge that gap. So I'm going to ask Kimberly to do the introductions as we get along, but I think what I'll do is I'll just do a bit of an overview of how it's playing out. And I think we're going to hear first from Ray, and Ray Copes, as you'll see from Kimberly's bio introduction, he's got a distinguished career where he himself has modeled bridging that gap. And I think it's so important you have someone who's tried to do it and has a lot of experience with it. Then a perspective from Quebec, from Nectaria. And a lot of us aren't aware enough of what's happening in Quebec, and they have a really different institutional framework that I think you're going to learn a lot from. And it's going to give us some ideas for the future in Canada and each individual province. And finishing off with David Fissman. David Fissman's been an incredibly important figure at the front line. He had some initial ideas and changed them somewhat in response to the emerging science. And I think you're going to see a really solid frontline perspective. So the combination of all this is really powerful.
Thanks, Alec.